Greetings, everybody, and welcome to the Dr. Jane Mackenzie live on a Thursday. We're taking a little bit of a different turn, considering last week and striking me off on the YouTube and stuff. So I thought I'm going to leave the case studies and things for a while and focus more again on the product. So I hope that's okay with you. And then at least I reserve my space on YouTube. So be that as it may, I'm wishing you all happy festive time, Christmas, and with the new year coming up. I'm sure we've got lots of resolutions that we're wanting to make. And as we follow our purpose, as we follow our path, and as we serve. So I said in the Christmas message as well, that we celebrate your contributions to holistic health and well-being, because the more of us that contribute towards holistic health and well-being, the greater the impact. And as we do that, and as we aspire to high levels of awareness, self-discovery, raised consciousness, we will reach higher levels of joy, freedom, peace, and unconditional love. So that was my wish to everybody. Welcome this evening. It's really a pleasure to see you here, and for us to move on. All right, so I'm going to be speaking to you today about DMSO, dimethyl sulfoxide. So that's DMSO here. This is our 50 ml bottle, 99% pure, and that is plant tree sap. And in the 1960s, it was brought to the fore by Dr. Jacob, and it was known as the miracle, the medicine wonder drug. And then, of course, things progressed, and the FDA got hold of it and decided that it was affecting people's eyes topically. So therefore, it was banned. And just on a personal level, I've even put DMSO straight into my eyes. I don't advocate that, but I've already done that, and there's no issue at all. In our eye drops, it's just a 1% DMSO. And in our nose spray, it's also just a 1% DMSO in the nose spray. So what does this magical product do? Because then in the late 1980s and the late 20th century, there was also another doctor that really put through a lot of information on the product. So you can really look and see on my website, the 365 Healthy by Choice website, and see really the huge amounts of benefits of this product. And I'm going to be sharing that with you today as well. So basically, it's a solvent. It's very levitational because it takes the nutrients from the roots of a tree, for example, right up the bark, right up the trunk to the very top of the tree and the leaves. So it's levitational in nature and expansive. So it has this very, very special ability to penetrate our skin. And in fact, that same Dr. Jacob called it water's alter ego. And it's a sulfur-based compound with really amazing healing properties. There was also in the late 19th century, that's what I was saying, sorry, in Germany, it was discovered as a byproduct of the wood pulping industry. So they would push the tree sap out of the trunks of the trees, and the wood when it was ground up. You do find DMSA in fruits, especially organic fruits, the sea, and in the atmosphere as well. So it's a naturally occurring sulfur-based substance in any event. However, the molecular bond with water is 3 times stronger than the water molecules bond with each other. So because of this, it's a substitute for water as it moves through the cell membranes, pulling substances through the cells that would ordinarily not penetrate them. And this is huge because it's not only the good nutrients that come through. So if you're on an antibiotic or a tranquilizer or a psychotropic medication, more will be pulled through. For example, we never bath in DMSO because the water is too toxic and too many of the impurities from the water will go into our body. We only use it for the foot soak. So one has to be very careful because it's not indiscriminate. It will just pull through whatever needs to be pulled through. However, when we're dealing with a healthy body and we're wanting to get rid of huge degenerative toxins, it's exactly what we need. So it's going to hydrate the cells, causing this changes in the liquid structure of the cell water. So its basic therapeutic principle is to alter and restore damaged cells by hydrating them, changing their water structure, increasing cellular permeability. That's incredibly important because it then allows the cell to nourish itself and dispose of wastes more easily. So you can imagine in the therapeutic realm that we're in, and when you combine it with the cell oxygen, what a potentiated effect you're getting. So we do use it. And, you know, there is a sulfur element to it. And I would say probably 1 in 500 people will show a quick reaction to the sulfur, a quick detox, put it that way. So you can always check the DMSO, put a drop or two on the inside of your wrist and see if it goes red. But really, it's 1 in about 500. So we always start slowly anyway. And I just point that out. A sulfur allergy is not correct. The sulfur reacting quickly, like a chlorella will act very quickly, and iodine will act very quickly, depending on the person. So it's just the rate of detoxification, and we can gently titrate it and build the body up to be able to cope with it. So because it passes easily through the skin and other biological membranes, it's fantastic topically. Absolutely fantastic. It will even get through to the bone, and I can share that with you. I'll share my own case study. So my one rib was broken last week. It was a yoga injury, not my fault, but anyway. And anybody who's had a broken rib or a cracked rib knows how sore it is. It's extremely sore. And also you can't breathe so well, etc., etc. Anyway, just want to cut a long story short. I've been applying DMSO along with some other things, including Chinese herbs and comfrey tea and so on. And in less than a week, I can honestly say the pain is down 50%. So they say normally for a rib to heal, it's about 6 weeks. And I'm wondering, I'm also taking obviously the cell oxygen, and I'm also taking the DMSO orally too. So let's see. So it does do that. It reaches right into the bone. You can feel it. Those people with pelvis and hip and lumbar and sacrum issues, you take the DMSO bottle, you unscrew it. This is how it would look. So you unscrew it. You put a few of the drops into your hand, and then wherever it might be sore, you just rub it in. And it's got like, it looks like oil, but it's not. And it doesn't affect your clothes or anything. Can you see it? It's not a question of rubbing. Then I think you're going to, it's too abrasive, and then the skin can get upset. So it's just really a question of applying it, and you leave it. It goes in. You will taste it in your mouth for sure within minutes. And just so you know that, and you can just drink a little bit more water. There's nothing wrong with that at all. So it starts detoxifying immediately. A lady came in about a week ago. She couldn't swallow. She thought she'd eaten some sort of make of chips that they'd altered and put terrible toxins into the chips. Anyway, she came in and I could see she was not a happy girl. She couldn't even swallow her saliva. She had to put it into a tissue. So I gave her 1 drop of the oxygen, and I said to her, apply the DMSO on your throat. Within minutes, she started breathing. The smile appeared. So it's instant. It doesn't take a long time to operate at all. Other things, so it's acting as a very potent free radical scavenger. So like way more potent than any antioxidant than you can think of. And naturally anti-inflammatory and pain relieving. So you can imagine all the dis-ease and the disorders that have pain and inflammation associated with them, just about most. So it's just a universal. That's what I can say. Something that you need in your medicine box, your health medicine box. And, along with the probiotic, the microbiome reset, along with your oxygen, along with the flaxseed oil, along with the zeolite, along with the replica RNA, DNA, along with the Almost Gold. You need it. You need it. And to drink it every day, imagine how it's hydrating your cells and repairing and getting rid of degenerative toxins in the body. That's just amazing. So it won't affect the natural cells. So it's basically colorless. I think you saw that, transparent. It's hygroscopic fluid. And, well, it can be used in a wide range of temperatures. However, just to point out that below 18 degrees, it freezes. So in winter time, I get a lot of calls and text messages. There's something wrong. The DMSO's, frozen. And it's nothing like that. You put it in a warm sock, keep it in a warmish area, and it's absolutely fine. So just that also is useful to know. And then sulfur is a naturally occurring element of the earth, and also one of the three major alchemical elements. And it's the 8th most prevalent element in the human body. You don't find it on its own, like in the DMSO. It will be in a combination. And sulfate, for example, you'll get it in a combination in a complex molecule. And just so that you know that. So let's have a look and see what it's used for. This is really, really amazing. And it's not limited to either. It's on my website as well. So here are these inflammatory diseases, arthritis, joint pain and relief. You put a couple of drops on your hand, you rub it into that knee on the front, you rub it onto the knee at the back, and you're going to get relief. Also, if we've got degenerative pain, and I'm being careful of my words here. Okay, one of the fantastic things about it, it lowers blood pressure. And anybody who's got a high blood pressure or knows somebody who's battling, speak to me quickly, because we can bring it down really, really quickly. I must say, it's really a savior there. Gastrointestinal disorders, headaches and migraines, fibromyalgias, muscle pain, bone pain, nerve pain, psoriasis, shingles, candida, infections, eczemas. So just again, be careful with the eczema and the psoriasis. If the skin is broken, just rather take it orally. Tendinitis, interstitial cystitis, autoimmune, amyloidosis, scleroderma, and you often get that in the lungs. Anywhere where there's plaque, and I'll talk about plaque a little bit later. Diabetic neuropathy pain. So it's wonderful in foot soaks. This product is on special at the moment, so go and get yours. It's about 50, 60 Rand less than usual. So we've really given you an extra Christmas gift here. And have a look and see get yours and stock up. Spider veins, varicose veins, apply topically, oral also, always in water. Burns and scar tissue, musculoskeletal disorders, furuncular otitis, that's the ear. You can rub it in beautifully around the ear, around the eyes, the neck. Complex regional pain syndromes, hemorrhoids, muscle spasms, bursitis, that will be an infection, acute respiratory distress syndrome, general stiffness and soreness, improves the range of motion, that's for sure. I mean, nobody would say that I had a cracked rib less than a week ago. And it's been x-rayed, so it was a crack. So here's something else nice. It reduces the collagen breakdown. So it improves and enhances the integrity of collagen. Wow, don't we all need that? Destroys fat cells. Don't we all need that? Helps with the formation of cartilage. Wow. Especially if you take it with lemon juice and vitamin C. Erectile dysfunction when applied topically, that's really useful. Prevents the side effects of chemotherapy. And I mean, this list just goes on. So I hope you're enjoying this and taking notes about the benefits of dimethyl sulfoxide, a plant tree sap, because it really is a wonder substance, natural substance. The side effects will be a little bit of a sulfur breath. that's it. Maybe a histamine release, but then reduce your dosage because it's working for you. There's 16 major therapeutic benefits that came from this other Dr. Morgan Walker in his book, DMSO, Nature's Healer. So how it blocks the pain. It interrupts and blocks the conduction in the small C fibers on which pain signals are conducted along the non-myelinated nerve fibers. The anti-inflammatory effect. It's bacteriostatic, fungostatic, and virostatic. Wonderful. Transports numerous pharmaceuticals across membranes. I did mention that. Reduces the incidence of platelet thrombi in the blood vessels. So ours is actually called the declot shot. The declot shot. And in fact, when we do live blood analysis, we do the live blood. We take a glass of the DMSO, about 5 drops. About half an hour later, we put the blood on the microscope again, and you can actually see the clots starting to break down. And you see the movement in the blood. You could do it even in less than half an hour. It's instant. So that's a fact. I've seen it. And we all need that. Living in cities, we just do. Has a specific effect on cardiac contractility by inhibiting calcium to reduce the workload of the heart. So it knows what to do. It stimulates prostaglandin synthesis, cyclical fatty acids that possess a diverse biological activities that affect cell function in every organ system. Prostaglandins have a sedative and anticonvulsive effect on the central nervous system. Just wonderful. Just relaxes everything, especially where there's a deficiency in GABA. It comes in to help us there along with the GABA neurotransmitter. It enhances antifungal, antibacterial agents when combined with them. So if you were going to use herbal, the cell oxygen, the almost gold, it's going to enhance the effect for you. It's a vasodilator. So probably that's related to the histamine release in the cells. But that's what you want in most instances, because then the blood can flow and the oxygen can get to the vital organs and you feel better immediately. The anxiety goes. So it also inhibits the release of cholinesterase, and that's for fat digestion. Tends to soften collagen, as we mentioned, and it has a peculiar cross-linking effect. It scavenges the hydroxyls of the free radicals, stimulates various types of immunity, potential diuretic, especially when administered intravenously, and this is where we have quite huge success as well. It brings about interferon formation in the organism and stimulates the healing of wounds. Fantastic. So if the skin is broken, of course, we're going to use it orally. The skin's broken, we're not going to apply it topically until the wound has healed. So, you're going to get a natural pain relief, inflammation relief, a scavenging of the free radicals, which is going to do the job of glutathione and vitamin C way, way, way in excess. But I would say pain is the major reason people use it, and inflammation that goes with it, and improves, your quality of life and your daily function. Also, it's not like a normal painkiller, where you're going to get used to the effect. In fact, it's got a cumulative effect. So you need to use less. That's interesting as well. And yes, I would speak to the doctor before administering DMSO, and if you're pregnant or breastfeeding, and that just needs to go in, because that's just like a bylaw. So that gives us, quite a nice, massive overview of the DMSO. So we'll use it straight in its 100% form. It's 99.9% pure. We use it in the nose spray. We use it in the eye drops. And can you imagine if it's having that cellular effect and on the membranes? Very, very important. We use it extensively with oxygen. We also use it in the eye drop with the castor oil. and we use it in our with castor oil as well. Just a note of caution: the DMSO likes to breathe, so we would never put it underneath the castor oil pack that's got a plastic inner to prevent the leaking of the castor oil, because DMSO likes to breathe. So you would just put the castor oil in the castor oil pack, but during the day you could easily put castor oil with the DMSO.